As Ireland's economy exploded, Ireland's healthcare system struggled to keep up. The archaic, half-private, half-public system has been improved ad hoc by different governments with no overarching long-term plan, a common problem for democracies. This has left us with Ireland's fragmented and inefficient healthcare system. Waiting lists for specialist diagnostics and procedures take between months and years, and hundreds of Irish people are waiting in trolleys in the hallways of Ireland's public hospitals as we speak. Ireland's healthcare spending per head of population is comfortably in the top half of OECD countries, higher than many countries with better healthcare such as Japan, the UK, Iceland and South Korea. As a result, 40% of Irish residents take out private insurance, the highest percentage in Europe. This crisis has steadily worsened since Ireland was forced to reduce their healthcare spending to eliminate their deficit and pay their debts from the recession in 2009. Sláintecare is the Irish government's proposed single, long-term vision for health and social care and the direction of health policy in Ireland, with cross-party support. It will introduce a single-payer, single-tier, universal healthcare with access to care based on need, not ability to pay. The Sláintecare report was produced by a multilateral parliamentary committee on the future of healthcare. The committee was supported by an academic team from Trinity College Dublin to analyse submissions made within 30 public hearings in the course of the public consultation process. In May 2017, the committee published its final report, which specified universal healthcare based on the following definition. A universal healthcare system will provide all types of healthcare services to the entire population of Ireland, ensuring timely access to quality, effective, integrated services based on clinical need. This means entitlement for all Irish residents to all health and social care, no charge to access GP, primary or hospital care, and reduced charges for drugs. Care provided at the lowest level of complexity, often outside of hospital in an integrated way. There have been many false dawns for Irish state healthcare, such as the Quality and Fairness Policy, which sounds alarmingly similar to Sláintecare, brought in by current leader of the opposition Micheál Martin in 2001. Sought to address long waiting lists and set out a 7 to 10 year plan to address this. It had many of the same goals as Sláintecare, including strengthening primary care, having equitable access to healthcare, and reduced waiting times. As we can see from the current state of Irish healthcare, it was far from success. Only time will tell if Sláintecare will be different. Now, I got onto Micheál Martin and Stephen Donnelly. Stephen Donnelly, for those who don't know, he's a super smart MIT and Harvard graduate who is spokesperson on health and will probably be our next health minister. And then we have Micheál Martin, who's the leader of Fianna Fáil, who's probably become the next Taoiseach. Emailed them both a month ago. And Stephen Donnelly's receptionist was quite rude. She was like, I am not confident any of us will find time to read a report from 2001 at the moment. I'm not asking you to read the report. I am asking a bloody question about like, why will this work? Well, basically, the Quality and Fairness Act, like, it didn't work and Sláintecare is so similar. And neither of them got back to me. Which is, and they're going to government now, and I don't know if I'm confident with them, but anyway, that's my rant over. The Sláintecare report includes a 10-year plan for implementation, currently being followed by the government. The implementation is split into 4 distinct streams: service redesign, service delivery, teams of the future, and sharing progress. Each of these work streams have 5 distinct programs to deliver the goals of the work stream, with the ultimate aim of delivering universal healthcare. The service redesign focuses on identifying what services will be needed, how much of them will be needed, where they'll be needed, and how best to deliver them. The Data, Research and Evaluation Programme will gather relevant existing and new data from national and international sources, such as census data and OECD reports. The Population-Based Planning Programme will use this data to define the health profile of each region in the country, allowing the government to accurately forecast what care will be needed, how much and where. For example, the government can predict from census data that Dublin will need the capacity to deliver about 40 births a day based on the birth rate of that region, and then they'll just do this for every single health service they deliver in every region. The Service Redesign Framework Programme is a gigantic part of the Sláintecare implementation plan, multiple times bigger than any other programme, and will establish models of care for every branch of medicine in which the government provides healthcare services, using the information gathered in the two previously named programmes. This will determine where and how people will be treated, using preventative care, such as the Healthy Ireland initiative encouraging healthy habits, therapeutic care, such as from therapists, social workers and foster carers, treatment, such as surgery and medication, rehabilitative and palliative care. The Sláintecare Integration Fund is a big pot of money and will play a big part in delivering the best models of care. Healthcare professionals and researchers can apply for funding for projects that will help the Sláintecare Implementation Office create the best models of care. Since this was announced, over 480 projects applied for the Integration Fund, and 122 of those were successful. It must then produce a capacity plan, which will quantify how many doctors, paramedics, nurses, hospital beds, intensive care units, maternity wards, and other staff and infrastructure will be needed to deliver the national model of care and where. It must be done as cost efficiently as possible while also reducing Ireland's huge waiting lists. This will ensure money isn't wasted building hospitals where they aren't needed, while other hospitals are bursting at the seams. Previously, these services were built when existing services were reaching or exceeding their limit. This new system is much more future focused and cost effective. That's why it's so important to fill out your census, guys. It's your civic duty. Once this is done, the government will know what services are needed, where they're needed, and the best practice to deliver these services. The Capital Planning Implementation Programme is responsible for allocating the €10.9 billion Sláintecare capital budget to infrastructure projects to deliver these services, by reviewing existing services and prioritising regions based on demand. The eHealth programme is focused on delivering the prerequisite ICT infrastructure to support the delivery of universal healthcare. This will include data gathering to improve health planning, systems to assist healthcare workers in providing the necessary care to their patients, such as a centralised national database, and identifying and supplying telehealth care. Every person who might use the health services in Ireland will be given an individual health identifier to provide healthcare workers with critical information such as underlying conditions, blood type, allergies, previous treatments, etc. A national, community-based e-prescribing programme will reduce prescription abuse, incorrect dosage, mistaken identity, adverse drug reactions, and paperwork for pharmacists. It will also hold doctors accountable for prescriptions given to patients, which increase prescriptions for generic prescriptions as opposed to their more expensive identical brand name prescriptions from 50% to 90% when this was introduced in Estonia. It also must be GDPR compliant, which means end-to-end encryption will be used and informed consent must be given in order to access this data. This workstream is focused on establishing the system that will be delivering these services, aiming to solve the problems within the current healthcare system. These problems are the lack of integration, lack of accountability, barriers to access, and inefficiency. Ireland's current healthcare system is fractured and inefficient. Hospitals are the go-to place for anything your local doctor can't fix, which has resulted in huge waiting times and overcrowding. To prevent hospitals from acting as a bottleneck in terms of accessing healthcare services, the Irish Government will establish Regionally Integrated Care Organisations, or RICOs. 6 RICOs will be established, with each RICO covering between 500,000 and 1 million people. Each RICO will be independent and have their own budget, and answer to the HSE executive and board on major issues. This will allow these regions to allocate their limited resources, such as staff and money, to exactly where they'd be most effective, while also increasing accountability in terms of finance and performance. The Irish healthcare system has had a number of scandals. The cervical check scandal emerged in 2018, involving several women suing the Irish Health Service, the HSE, after they falsely received positive and negative smear test results for cervical cancer. Ireland is also building the most expensive hospital in the world, the National Children's Hospital, both in terms of cost per bed and overall cost. It was initially projected to cost €650 million, but is now projected to cost over €2 billion, another source of public outrage. The Irish government is keen to avoid any future scandals, so safety and cost efficiency are taken into consideration when making any more decisions on healthcare. The reasons these scandals were allowed to develop is because there was nobody responsible for making sure they didn't. There was nobody within the HSE accountable for the accuracy of test results, nor was there anybody accountable for the National Children's Hospital's budget. Sláintecare seeks to rectify this by clearly defining who's responsible for quality assurance of all services the Irish Health Service provides, as well as who's responsible for budget overspending. The individuals will hold this responsibility, as opposed to the committees who were responsible in the past, ensuring personal accountability. The civil servants who are accountable for these roles must implement and uphold transparent auditing procedures. As mentioned earlier, Ireland has the largest private insurance membership in the EU. Over half of hospital beds are provided by the private sector, although only around 9% of beds were private for profit, compared to 30% in Germany and 24% in France, but 2.2% in Denmark, and almost all general practitioners and pharmacies work in the private sector. These resources must be utilised by the Irish government in order to deliver universal healthcare as efficiently and cost effectively as possible. The government plans to do so by clearly redefining the role of the private sector within the Irish healthcare system, which involves slowly removing private activity from public hospitals. Private practice in public hospitals generates around €50 million in revenue for the government, and only 6% of all Irish consultants are on public-only contracts. By removing private practice from public hospitals, the government will lose a significant stream of income, and recruitment of highly qualified consultants will be made even more difficult. However, it has always been known that universal healthcare would cost the government more than the existing healthcare system, and the benefits of economies of scale and more equitable access to healthcare outweigh the short-term costs. There are a number of barriers in access to healthcare, and private health insurance is just one of them. Location, bureaucracy, time, and cost are all barriers that hit poor, rural, full-time workers the hardest. The Eligibility and Entitlement Programme seeks to remove as many of these barriers as possible to introduce true universal healthcare. As mentioned before, Sláintecare will cost the government more than the existing healthcare system. The Financing Reform Programme seeks to find sustainable, accountable, cost-efficient financing system to deliver universal healthcare. It will design a system to allocate funding to each RICO based on need, develop a multi-annual budgeting system with accountability and future planning, and develop a system to repeatedly audit its own finances to find ways to reduce costs and increase efficiency and compare them with international standards. Ireland has the most medical graduates and nurses per capita in the EU, but has less doctors per capita than the OECD and EU average, and is overly reliant on internationally trained doctors. Irish consultants provide 40% less consultations than the EU average, and 87% of current medicine students in Ireland are either intending or at least contemplating emigration after graduating. Ireland is underpaying its doctors, leading to high emigration, and is underutilising its highly skilled consultants, partly due to its inefficient public-private model. This workstream seeks to rectify this by focusing on supplying the health service with the necessary workforce to deliver universal healthcare, as well as making best use of the existing workforce and allowing them to shape and improve their workspace. The workforce planning program will involve short, medium and long-term planning to ensure the new models of care are sufficiently staffed. This is in response to the OECD review of the Irish Public Services, which recognised the need for the HSE to develop better long-term workforce planning. Not only will this plan the future workforce, but it will also implement systems to ensure the Irish Health Service is never understaffed again. As mentioned earlier, Ireland has the highest rate of nurses per capita in the EU. By sufficiently utilising the medical professionals, Ireland can significantly increase its healthcare capacity relatively easily. As part of the Training Pipeline and New Ways of Training programme, a role for advanced nurse practitioners will be developed. This will involve attaining a master's degree in advanced nursing practice and will empower them as senior decision makers with the ability to undertake a comprehensive physical and mental health assessment of patients, diagnose, plan and deliver in primary care centres, reducing the workload of doctors and keeping non-urgent patients outside of hospitals. Another part of this programme is to improve graduate retention and maximise the benefit from investing in medical education, which the government aims to do by reducing overall workload for trainee doctors, especially non-core tasks by delegating it to certified nurses, provided time and funding for additional training, reduced paperwork, and granting greater clarity and certainty regarding work hours, location and career progression. As we've already established, Sláintecare will require a complete overhaul of the Irish healthcare system. This will require changes to the way our healthcare workers operate. The Culture Change and New Ways of Working programme will redefine the roles of existing healthcare workers to adjust them to the new universal healthcare system, with a significant shift towards community-based care and away from hospitals. Scope and working hours may be extended, and new contracts and performance management will be introduced with the aim of maximising our healthcare workers' ability to serve the population. Almost every single recommendation implemented as a part of the Sláintecare implementation programme came from a team of academics, in consultation with senior doctors and consultants, and possibly from data from surveys or interviews with healthcare workers. These are great for the big picture, adopting international best practices and getting us headed in the right direction. But nobody has more knowledge of the minutiae of the Irish healthcare system better than our healthcare workers, who are in there every day actually doing the work. This minor programme, called the Innovative/Capacity Building Programme, might just be the most important part of ensuring the long-term viability and maximising the efficiency of Sláintecare. In 2018, the HSE, with the help of KPMG, consultancy and accounting firm, adopted the NHS's award-winning Leadership Academy. True leadership is unlocking the potential of those you lead, and the HSE aims to develop their experienced managers to unlock the full potential of healthcare workers. As part of this programme, new courses will be introduced to the Health Service Leadership Academy to upskill Irish healthcare workers and allow them to modify and improve existing systems, with these modifications being scrutinised and potentially implemented nationwide, thus constantly evolving and improving the HSE. Included in the Sláintecare programme is a Future Intelligence/Influencers programme. On their document that they've released and on their website, they say this programme will horizon scan for new initiatives and enablers which may help the workforce to deliver the best service to patients, service users and clients for the optimum value to the taxpayer. And they say they'll do this by conducting research on potential impact, that's typo right there, on the potential impact of AI, robotics, etc. on workforce planning and on services for patients and service users. Now, they have given zero information about how they plan to do this, and I've also tried reaching out to them and I specifically asked them about this. No one in the Sláintecare office would get back to me. Some of them, their emails didn't even work. So Look, this plan, look, I'll comment on it at the end, but just keep a dose of skepticism when you're listening to all this. Workstream 4, titled In Sharing Interest, is the administrative workstream which makes Sláintecare a reality. It is concerned with monitoring the implementation of Sláintecare, with the aim of communicating progress across the health service and general public, ensuring the implementation of Sláintecare, and preparing budgets for all aspects of Sláintecare's implementation. The Citizen and Staff Engagement and Empowerment Programme ensure that the general public and health workers know what's happening with regard to Sláintecare. If the general public don't understand what's going on with Sláintecare or don't think it's a good idea, they won't want their tax money being spent on it, which means politicians won't allocate money to Sláintecare and it won't become a reality. Sláintecare is a plan made by the people, for the people, and as long as both those remain true and the public know it, Sláintecare will be a success, or at least the Sláintecare Implementation Office is hoping. Citizen engagement events will be held across the country, where Sláintecare Implementation Office staff will be sharing progress made on implementing Sláintecare, including Executive Director Laura McGahey. These events will be open to all healthcare workers, media, and citizens interested. As part of trying to involve healthcare workers in improving the Irish healthcare system, the government is trying to engage staff, which means aligning their behaviour with the wider Sláintecare goal of improving the health service. They plan to do this with a series of engaging health staff action plans introduced multi-annually, with the goal of implementing 4 factors within the workspace. They are engaging managers who treat staff fairly and with respect, ensuring employees' voices are heard, listened to and considered, ensuring the values of the organisation reflect those of its workers, and ensuring that its mission statement and vision for the future engages, excites and motivates its workforce. This comes with many benefits, including higher staff morale and job satisfaction, which leads to better care, increased productivity and higher wages and income growth. As part of the Sláintecare programme, the Access to Information and Health Identifiers programme, which is in the office of the government's Chief Information Officer, has a team that are currently responsible for the development of an e-citizen health portal prototype, which will provide citizens with access to health information relating to health services in their locality, health information relating to their own health conditions, appointment booking facilities for health services, and secure access to their health information as part of their patient summary record. It will allow the HSE to capture critical data on the service user experience, allowing healthcare workers to make better informed decisions and to provide better individual care, and allow the HSE to identify weak spots within their healthcare system. Health literacy is defined as the ability to make informed health decisions. By improving the ability of the Irish public to understand their own health and the effects of their actions or inaction on their health, the overall health of the nation can be greatly improved. As part of Sláintecare, the Implementation Office will scope initiatives that support health literacy, such as issuing plain language guides to frontline health staff, supporting public awareness projects such as Healthy Ireland, and increasing the readability of medicine instructions. The Sláintecare Programme Implementation Office and Governance Programme will create the structures that deliver all projects in the implementation of Sláintecare, prioritising projects that require early delivery. It will convene task forces, allocate responsibility, and organise regular meetings to ensure delivery. The Evaluation Framework and Reporting Progress Programme will evaluate the progress of Sláintecare and will involve reporting on how the Department of Health, HSE and others are progressing with the delivery of Sláintecare's objectives. Integration Fund and Sláintecare Budget Management Programme will manage the Sláintecare budget. This will begin with allocating funding from the Sláintecare Integration Fund to different projects and designing new projects that will be needed. It will also budget for the supporting infrastructure that will be required to deliver Sláintecare, such as primary care centres, training programs, and ICT equipment. Communications program and Recognising Success program, which seem to be two programs wrapped into one, will publish all progress on Sláintecare, such as the annual start of year action plans and biannual progress reports. Recognising success and taking note of missed goals to ensure the ongoing implementation of Sláintecare. Okay, so look, do I think Sláintecare be implemented? I mean, probably, yeah. I mean, the government have gone ahead and so you know the way they're separating public and private, and that's a huge thing, because man, we spend almost as much in the private sector than we do in the public sector on healthcare. But the public sector treats so many more people. It's way more efficient. You know, when you don't have to process payments and do advertising, all that crap. Like, if you were to look like the figures, it's really like they're about 5 or 6 times more efficient at treating patients. So if we just eliminated the private and had all public, and we gradually increase the size of the public sector, we'll be able to bring this in. We'll have the capacity, because we have a capacity issue at the moment. The government have gone ahead and they've made a tough decision. They've decided to only offer consultants who work in hospitals. So these are doctors. They're only offering public only contracts. So they're removing private practice from public hospitals, and that was a tough one, and it cost them money, and doctors weren't happy about it. But like, do I think they would do that if they weren't intending long term on implementing Sláintecare? No. And also, that was done in December. Right now, we're in the middle of Corona. Everyone is super concerned about their health. I think it will sound a lot worse in the media if it comes out that the government is not giving money to Sláintecare after our worst healthcare crisis in the history of the state. So it could go either way. It could go either way. Like, because we're in a recession now, we don't have that much money, so can we even afford it, you know? And like, if you can't fund the whole thing, you won't, like, if you can't fund all of Sláintecare, like, every part is so important. It's like an arch, and you miss one thing and it almost all falls apart. But I'm optimistic. I think it will happen. And yeah, so anyway, look, that's the video. I hope you enjoyed it. I hope it was educational, informational. I found it really interesting to, interesting to research it. And I put a good few hours into this. This is a informationally dense video. Like, if this was a food, it'd be a steak, just so nutritionally dense. But yeah, anyway, look, like the like button, Máiste Dhola, and subscribe. Máiste Dhola is Irish for please. Hit the subscribe, for fuck's sake. Like, I have like 7 subscribers. Just subscribe, man. Anyway, look.